Hello, everyone, and welcome back to Psychology
What's eating
Eats.
you?
So, what's eating you?
Psychology Eats is
Today's
here
topic
to help you.
is
What's
your
eating
knowledge
you?
of psychology. So, I'm going to give you 10 questions, true-false answers, and I ask the question. I'm going to pause a little and give you a chance to say true or false. Then I'm going to give you the answer and the explanation for the answer. So here's question number 1. A psychiatrist is a medical doctor. The answer is true. A psychiatrist is a medical doctor. A psychiatrist study the brain in medical school. A psychiatrist can write out scripts, medications, prescriptions, and give diagnosis. Number 2, a psychologist can administer medications. True or false? The answer is true and false. It depends on the state in which you live. But in many states, or probably I would say most states, a psychologist doesn't have privilege to write scripts, psychotrophic medications. In some states, he or she may. And that could be a limited medications. So usually a psychologist does assessments, research, teaching, talk therapy, other different jobs within the field of psychology. Number 3, if a person has bipolar disorder, it means they have a split personality. Is that true or false? False. It is false. Bipolar does not mean split personality. Someone with bipolar has episodes of mania and depression. Split personality is a totally different diagnosis. Number 4, Thomas hears voices and talks to himself. Thomas has schizophrenia. True or false? That is true. Thomas is most likely a schizophrenic. I have personally, in my many years of working in the field and working with schizophrenics, I have never met a schizophrenic that did not hear voices. That is really a baseline of the disease. So that answer is true. Number 5, mentally ill people are crazy. Mentally ill people are crazy. Is that true or false? Well, obviously, calling someone crazy is not nice, and that's not a word that we would use professionally. But we have all said it. We have all called people crazy who don't have a diagnosis of being mentally ill. So I'm going to say it's false, because although we know people who don't have a diagnosis, they can act real crazy. So crazy is subjective, but when we're talking about someone with a real diagnosis, we wouldn't call them crazy. Number 6, the street name for Xanax is Xannies. True or false? That is absolutely true. And depending on where you live, you could call Xanax or any med within the benzo family. Depending on where you live, depends on the street name. We know that med is used, benzos are used to treat anxiety, but people do misuse them and become addicted to them. And so, which is why doctors have to be really careful when prescribing benzos. Number 7, psychotrophic medications cure mental illness. Is that true or false? That is false. There is no cure for mental illness, but treatment is available. And over the last 25, 30 years, medications have become much better. There are a lot of medications to choose from on the market. I would say to people who are kind of trying to get their mental illness stable to hang in there with medications. You may have to try a few before you find out what really works for you. Number 8, the mentally ill are, Number 8, the mentally ill people are violent people. True or false? That I'm going to say is false. As far as people with mental illness, obviously can be violent, especially if you mix in them being unstable, on drugs. There could be some violent tendencies. But overall, someone with mental illness is probably in most cases going to hurt themselves before they hurt someone else. So I would say overall that answer is false. Statistically, it's false. Number 9, people that are bisexual, homosexual, transgender are mentally ill. Are these people mentally ill? The answer is false. That is false. In 1970-ish, the world of psychology deemed them not an illness. That's not an illness. But obviously people who are bisexual, homosexual, transgender may come into treatment just because they have issues that they want to deal with. It could be related to their sexuality or not. So yes, they come into treatment, but the goal of the treatment is not to fix their sexuality. That's not the goal. Number 10, nomophobia is the fear of being without your cell phone. And so if you have a fear of living without your cell phone, or thinking if someone wanted to pay you $100 to be without your cell phone for a week, would you do it? For a day, would you do it? So nomophobia, there are many, many, many phobias. That's just a funny one because people don't want to give up their cell phones. But nomophobia, if you know or felt anxiety because you've left your phone at home and went about your day and then you realized you didn't have it, then you may have nomophobia. So that is just a quick knowledge of psychology. If you got them all correct, then you pretty much kind of know what's happening in the world of psychology. If you don't, that's okay. Stay with me. Stay with this channel. Do some more investigating. Check out other channels to learn more about this world of psychology and what we do to help and bring people a better way of life, better sense of self. So don't forget to like, subscribe to this page, and also comment below. Let me know anything that you want me to cover in the content or in future videos. Thank you.